Lip treatment with hyaluronic acid is another super fascinating topic. I love enhancing lips with hyaluronic acid. However, there is a high risk of complications of vascular injuries if one does not have a good understanding of the anatomy. Remember, we can perform hydration, contouring, or filling on the lips. It is quite an uncomfortable procedure. I do it with topical anesthesia, applying numbing cream on the patients for about 40 minutes. I occlude it, and then I perform the procedure with either a cannula or a needle. I prefer the needle for lips, but it's a high risk area. I choose the needle due to my experience. Though we're not exempt from vascular accidents, still I know what to do, and I've had good results, so I preferred using a needle. It's a process. Some patients will experience significant swelling. When we do lips, patients often say they don't want their lips to look too big. But after the procedure, they leave with swollen lips because it's an inflammatory process. There is a lot of inflammation in patients. Post-procedure recommendations are crucial. Remember that vascular accidents can occur up to 3 hours after the procedure. So we must stay vigilant. Avoid recommending cold compresses to patients right after lip treatments. We need to closely monitor for any potential vascular accidents. Although lip blood supply comes from both sides, if there is an obstruction of the artery, not just some branches but the artery itself, we might face complications such as tissue damage or loss. So it's important to be very alert. We must understand our patient's desires. If a patient with thin lips wants fuller results, they need to have naturally beautiful lips. If the patient has less defined lips, we can't promise Angelina Jolie-like results or a perfectly defined contour. With hyaluronic acid alone, it's impossible to create lips that aren't naturally harmonious and turn them into perfectly defined ones. Therefore, be very honest with patients. If they have thin lips, don't aim to make them much fuller in a single session. It might take multiple sessions and various techniques to achieve noticeable volume. If patients have had thin lips their whole lives, we can't expect to give them plump lips in one session. We always aim for natural results without overfilling. Discuss with the patient what they want: hydration, contouring, or filling. Advise them on what is best to give them projection and volume. Nowadays, we don't use as much contouring around the lip edges. Instead, hydration through Russian lip techniques that support the columella is preferred, giving a more beautiful appearance. When filling the lip border, we sometimes cause eversion rather than achieving the desired projection. Now, each practitioner uses their preferred technique. These are basic principles of hyaluronic acid. And as we continue to train and learn different techniques, we become more skilled in one or another. If there is any presence of substances like biopolymers, it's ideal not to perform treatments on the lips, cheeks, nasolabial folds, or any area with suspected biopolymer application. Using hyaluronic acid in these cases can destabilize the biopolymer molecules and lead to inflammation. So if there are biopolymers in the lips, it is best to refer the patient to a plastic surgeon to have all these biopolymers removed. Then you can restore the volume if there is a loss or scarring process. For lip treatments, we will use hyaluronic acid of low or moderate density, depending on what we want to achieve. We should not use very high densities with high G' values to avoid making the lips too rigid. The lips are a highly mobile area and an essential part of facial expression. Therefore, they need to remain soft and flexible. We can use moderate or low density hyaluronic acids that are elastic and viscous, ensuring a soft and mobile result. Remember the anatomy of the lip. There is a dry mucosa, a wet mucosa, the philtrum, the cupid's bow, the vermilion border, and the lip commissures. The facial artery branches are usually around 1.5 centimeters or 15 millimeters from the lip commissure, about a finger's width outwards. However, there can be anatomical variations in the facial artery branching. These arteries are deep, so if you perform the treatment superficially, there is no risk of vascular injury. However, if you go deeper with the needle, there is a risk of a vascular accident. Use topical anesthesia before the procedure and soft hyaluronic acid fillers with moderate or low density. Regarding technique, if the cupid's bow is not present, do not try to create it. If the patient lacks a philtrum, don't attempt to form one. It was once very trendy, and some still do it, but creating a philtrum when it's not naturally present does not look beautiful or natural. If the patient has a philtrum and you want to project it slightly, that's fine. But if the patient lacks a cupid's bow, the small heart shape in the middle of the lips, don't force its creation. Instead, enhance other areas of the lips to make them look beautiful without forcing unnatural features. There was a technique of injecting in the middle of the lip, but it often resulted in a peak on the lip, which is not very aesthetic. I prefer the hydration technique, creating columns that give more projection and height to the lips without adding too much volume. I prefer to give more volume to the lower lip. Remember that the lower lip should be twice the size of the upper lip, and maintaining this harmony results in a more beautiful outcome. If you want to widen the lip, fill it to the edge, up to the lip commissures. However, if you wish to shorten the mouth, mark a line down from the nasal wing and avoid injecting the lips beyond this line. Even when there are depressions at the lip commissure, you can inject small columns to elevate the sunken area. When the commissure turns inward, injecting columns of hyaluronic acid can beautifully lift the lip. However, avoid injecting or adding volume from the nasal wing outward unless specifically indicated, as this can lead to an overextended appearance, making the lips look thick in that region, something that is generally not aesthetically pleasing. If you look at natural lips without hyaluronic acid, you'll notice that the corners of the lips don't have excessive volume. If we add too much volume to this area, we risk creating overly plump, sausage-like lips, which we want to avoid. Injection in the lip contour should be more superficial because the artery lies deep beneath the orbicularis oris muscle. Therefore, it's crucial to have a good understanding of the anatomy. As I mentioned, the superior and inferior labial arteries are situated deeply behind the muscle. Hence, injections should be administered more superficially between the mucosa and the fat layer to avoid complications. although there are anatomical variations. You should always aspirate before injecting. When enhancing the lip contour, the injection should be along the vermilion border at the dermal or subdermal layer. This technique provides hydration and a bit of projection without trying to elongate the lips, offering a subtle and attractive enhancement. The 5-point volumization technique focuses on the dry mucosa of the lip. Personally, I'm not fond of the middle point, although it is referenced in current literature. However, techniques evolve, and each time you attend a conference, you may discover a different approach. Therefore, it's essential to stay updated with the latest techniques by attending events and referring to books that offer foundational knowledge and newer practices as a reference point. For volumization, injections are made in the submucosal or intramuscular layer beneath the mucosa of the lip to prevent vascular injury. Injecting at the junction of the dry and wet mucosa can help reverse lip inversion caused by aging. When hyaluronic acid is placed at this junction, it can invert the lip and provide greater projection. These are the 5 points of lip volumization. You can start with hydration, enhance the lips' height, and if necessary, add volumization at these 4 or 5 points. Personally, I prefer the 4-point technique as I'm not a fan of the central point. When volumizing with a cannula, the entry is made through the lip commissure into the mucosa. Using a fanning technique to distribute a good amount of hyaluronic acid. This technique helps increase lip volume or hydration. These are the points by Dr. Di Maio, widely recognized worldwide. You can use these points as a guide, but I suggest using the technique you feel most comfortable with. It is beneficial to know different application models, allowing you to incorporate the elements you prefer from each method to provide aesthetically pleasing results for your patient. So he separates the application zones into LP1, LP2, LP3, and even goes up to LP8. LP1 is for volumization, as you can see there. LP3 is for lip contouring, and LP2 is for the Cupid's bow. But remember, if there is no Cupid's bow, we can't work on it. I bring this up so you can see the different techniques. These different application points can be done with a cannula, leaving microboluses, or with needles. Each of these points has a specific effect. For example, LP1 promotes lip enhancement, meaning the volumization of the lip, which is achieved through 4 points. LP2 provides structure to the Cupid's bow region, meaning the Cupids are sheer. But if the patient doesn't have it, we can't create it, or it will look very strange if we try. LP3 provides structure to the white line or the margin of the lines and improves perioral lines. However, now with the Russian lips technique, which involves injecting columns around the entire dry mucosa, it also corrects perioral wrinkles. Personally, I don't really like defining the lip border. I think it looks too artificial. Lips don't naturally have those sharp edges. But when I use the column technique for projection, it works much better for me. Now, if the lip contouring technique works perfectly for someone, that's great. What we call profiling perfect. If it works for you, perfect. LP4 projects the medial tubercle of the upper lip, which is this little triangle here. LP4 is this one right here, and he combines it with LP5. But personally, I don't really like this central point. I prefer to treat it, and we'll see this in practice. Using a fan technique in the dry mucosa is done to give more support, but I avoid adding volume there because it can create a little bump and it's not very anatomical or natural. These are more LP8 zones, as I mentioned. LP8 can be even correct perioral lines. Those lines can be corrected, but if very dense hyaluronic acid is used, the wrinkle may still remain. Personally, when dealing with deep perioral wrinkles, I use laser technology first, followed by hydration fillers only. These are subcutaneous, meaning very superficial, to hydrate these lines. These are some results. If you have nice lips, you need to maintain nice lips. The first patient shows well-defined lips with a clear philtrum, a cupid's bow, and good volumization. What was done here was simply increasing hydration. If you notice greater swelling on one side than the other after applying the same amount, it could be due to inflammation, possibly a hematoma, hitting a small blood vessel, or simply the patient's reaction. So if you see that one side is bigger than the other, give the patient about 15 days, and after 15 days or a month, reevaluate with the remaining hyaluronic acid. See if they need more or if the swelling has gone down. If it hasn't, it means there was more volume there. So you adjust the other side. However, the idea is to treat the lips in 2 or more sessions. I always do 2 sessions, and I always call the patient in for a follow-up. I also give them warning signs to watch for in the first 3 hours. Notice the second patient who had perioral lines without even doing the contouring, just by applying hydration in columns, there was improvement. These aren't as aesthetically pleasing lips as the first patients because while they are defined, they are not very prominent or volumized, and she didn't want volume anyway. But the improvement in her perioral lines when she moves her mouth, that's what we're aiming for. The goal is to enhance the projection of the lips in a way that feels natural to the patient. You want the patient to feel comfortable, not like their lips are too big, because not everyone wants bigger lips. The key is to achieve a harmonious projection that complements their face. This is another patient whose perioral lines were corrected using the column technique. Obviously, this patient has a very pronounced nasolabial fold in a very noticeable marionette line, but she only wanted work done on her lips. Later on, she was offered support points to correct her marionette line. But notice how beautiful it is to correct the perioral lines using only the lip hydration column technique. Both the upper and lower lips are corrected. The perioral lines improve, and the lips are given projection.